Bronchitis and pneumonia are respiratory conditions that affect the lungs, but each presents with its own challenges and symptoms. Bronchitis is characterized by inflammation of the bronchial tubes, leading to a persistent cough that often brings up mucus, whereas pneumonia involves an infection of the alveoli, resulting in coughing that may produce phlegm, fever, and difficulty breathing. Treatments for bronchitis typically focus on symptom relief and may include rest, fluids, and cough suppressants, while pneumonia requires more aggressive care, often involving antibiotics, hospitalization, and respiratory support in severe cases. Smoking, poor immune function, and chronic lung conditions are risk factors for both diseases, making prevention and early treatment crucial. Here's a detailed exploration of the distinctive aspects of bronchitis and pneumonia to understand these diseases better. Nature of infection: acute versus progressive. Bronchitis and pneumonia both affect the respiratory system but differ in progression and infection site. Acute bronchitis involves the bronchial tubes, causing a cough that comes on quickly and typically resolves within weeks. Symptoms include mucus discharge, mild fever, and fatigue, often triggered by viral infections. On the other hand, pneumonia is more severe, involving the lungs' air sacs, potentially progressing over time, leading to a higher fever, a more productive cough with discolored phlegm, chills, and difficulty breathing. Bacterial, viral, or fungal pathogens can cause pneumonia, demanding urgent medical attention to prevent complications. Identifying and treating the specific cause is vital for recovery, making the distinction between the two conditions a critical factor in patient care. Location of inflammation: airways versus alveoli. Bronchitis and pneumonia are respiratory conditions that, while sharing some symptoms, differ fundamentally in the area of the lung affected. Bronchitis involves inflammation of the bronchial tubes, which carry air to the lungs, leading to symptoms like coughing and shortness of breath. On the other hand, pneumonia is the inflammation of the alveoli, the tiny air sacs where oxygen and carbon dioxide exchange occurs. Patients with pneumonia often experience more severe symptoms like high fever, chills, and a productive cough, often with discolored or bloody mucus. Accurate diagnosis is crucial, since pneumonia can lead to more serious complications and typically requires a different treatment approach compared to bronchitis. Severity of symptoms: mild to moderate versus severe. Bronchitis and pneumonia, both affecting the lungs, present a crucial differential in symptom severity. Bronchitis, typically caused by a virus, manifests with a persistent cough, often producing mucus, along with mild fever and fatigue. It's largely self-limiting, resolving with rest and home care. On the other hand, pneumonia, potentially triggered by bacteria, viruses, or fungi, ushers in more severe symptoms: a high-grade fever, chills, a deeper cough with discolored or bloody mucus, and breathing difficulties. As pneumonia affects the alveoli, causing them to fill with fluid or pus, it can significantly reduce oxygen exchange, necessitating medical intervention and sometimes hospitalization. Recognizing the severity spectrum is essential for timely and appropriate treatment. Radiographic findings: often normal versus infiltrates present. Radiographically, bronchitis and pneumonia can be distinguished by the nature of lung involvement visible on imaging studies such as chest X-rays or CT scans. In cases of bronchitis, which is an inflammation of the bronchial tubes, the radiographic findings are often normal because the primary site of infection is in the airways, not the lung parenchyma. This lack of visible changes on X-rays can sometimes make bronchitis more challenging to diagnose. In contrast, pneumonia is characterized by an infection within the lung tissue itself, leading to the presence of infiltrates, areas of increased opacity indicative of the body's response to the infection. These infiltrates can be patchy or consolidated, and their presence is pivotal in confirming a pneumonia diagnosis, differentiating it clearly from bronchitis. This radiographic evidence is critical for physicians to tailor the most effective treatment strategies and for predicting patient outcomes. Response to treatment: self-limiting versus may require hospitalization. Bronchitis and pneumonia can present with similar symptoms such as cough and chest discomfort, but they differ significantly in their response to treatment. Acute bronchitis is often self-limiting, with the body's immune system sufficient to clear the infection without the need for antibiotics, especially when it's viral in origin. Plenty of rest, fluids, and over-the-counter medications may suffice. In contrast, pneumonia is more severe and may require hospitalization. Bacterial pneumonia, in particular, needs antibiotic therapy, and severe cases might necessitate supplemental oxygen or even mechanical ventilation to support breathing. The risk of complications is higher with pneumonia, demanding a more aggressive treatment approach and closer medical supervision.